Certain drugs like relaxants and sedatives can mask your brain functions. So it is necessary that these levels must be lower in your body before a testing of brain death is done. When the levels are high, then you have to wait till the levels come down before the testing is done. Now you might all have one question in your mind, that is, even after brain death, how does an individual's heart beat continuously? Well, the answer is simple. The heart has its own pacemaker known as the SA node. The SA node has the potential to generate impulses on its own continuously, even without the stimulation from your brain. That makes your heart beat continuously. So as long as there is supply of oxygen to your heart, it can beat continuously. That's what a ventilator does. A ventilator continuously supplies your heart oxygen, and it can make your heart beat for several more hours. A patient in coma continues to have brain activity and functions, but in case of brain death, all the brain activity ceases and the functions are lost. Before brain death is confirmed, everything possible to save an individual's life is done. After the diagnosis of brain death is made, there is no chance of recovery. Once the diagnosis of brain death is made, an individual is pronounced legally dead. This is the time that should appear on the record of death certificate. The time of death is not the time when the ventilator is removed. Causes of brain death: anorexia, ischemia, intracranial hematoma, a gunshot wound to the head, intracranial aneurysm, brain tumors. When any of these occur, they cause swelling of the brain. Because of the brain is enclosed in the skull, it doesn't have any room to swell. Thus, intracranial pressure increases. This can stop blood flow to the brain, killing brain cells and causing herniation of the brain. When brain cells die, they do not grow back. Thus, any damage caused is permanent and irreversible.